Buongiorno e benvenuti. Il futuro dei sistemi.
Good afternoon and welcome. The future of healthcare system after the pandemic. And welcome to this special edition of the meeting. It is a special edition because we are here in Rimini, and this is a great opportunity of international encounters that lets us give our contribution thanks to the presence of so many distinguished guests, hoping that we will be able to share all our worries at the moment. I'm really glad that this year edition is taking place. A lot of sessions can be seen on the YouTube channels, and I would like to thank for being with us from Germany, Luisa Denkel from Germany, from Brazil, Luis Eugenio de Souza, and from the United States, Professor Paul Barak. Whereas we have here with us two friends, friends of the Rimini meeting, Professor Giorgio Vittadini and Professor Walter Ricciardi. And well, I have to apologize, but I will have to be pretty strict in terms of the time allotted to everyone here. There are a lot of questions that we have already received, so we hope we can have also some time for interaction, for a dialogue on this international situation with reference to COVID. So I will now leave the floor to Professor Giorgio Vittadini, who will give us an introduction to this theme. Well, we have played a small part in this struggle against the pandemic because the Rimini meeting in Italy is the first public event taking place after the beginning of the pandemic. And as I was saying before when I talked to Walter, in the respect of all the rules foreseen by the authorities. That means that we can start again by respecting all the rules because there are different groups and ways of thinking. There are people saying we can no longer do anything. Well, this is not true in a way. We have different sessions on healthcare. We have 3 sessions actually. Yesterday we met Commissioner Arcuri and other guests, and we talked about what happened in terms of response to the pandemic in Italy. This afternoon, there will be a debate with the Italian Minister of Health, Speranza, and the presidents of some Italian regions and the representatives of some public and private hospitals. And we were talking about this aspect, the interaction between public and private sector in the healthcare system. And then we have the session with all the experts from the healthcare point of view that will be talking about how we can face this pandemic. So we want to know more, we want to understand better, because we want to go on cooperating in the reconstruction of the country and of the world, because, well, obviously, disease obviously do not know any borders, so we have to work together. So I will now leave the floor to Walter. Yes, thank you, Professor Vittadini, for your introduction. Let's have this debate starting with a few questions. So I will ask Professor Ricciardi, because Italy was the first European country to be hit by the virus, and we have been talking for 3 years here in the Rimini meeting of the healthcare system and how it works, whether it works well. And after we were at the beginning seen as those who were spreading the disease, And but now everyone recognizes the important role played by Italy in terms of response to the pandemic. So I would like to hear your point of view, your opinion on those dramatic months of emergency and how we are moving on. Well, I'd say that the main key was that our Minister of Health immediately understood that decisions had to be taken on a scientific basis, that this attitude, this approach was adopted by the whole government, and we took decisions that then afterwards were taken also by many other countries, even though not all the countries. So we took brave decisions in a moment when the problem was seen as an Italian problem, so we understood that we had to take drastic decisions. We were the first to declare the lockdown. Yesterday, Deborah Pearson was against the measures against the pandemic in the United States, said, I wish I did it myself. And because this is the only way to actually limit the transmission of the pandemic and the repetition of those terrible situations we experienced in Bergamo, in Lombardy, because the virus hasn't changed. It is the same. It has the same power, and this is the same virus that is making victims in other countries, in Brazil and the United States. So we needed to be ready to give the same serious, strict response. We are talking about a second wave at the moment, but actually we are not even at the end of the first one. We have limited it. We have actually reduced the curve, and we knew that if we decided to give up the measures too soon, opening up to certain things that were not compatible with a pandemic, if this virus is transmitted through people, this means that until we have a therapy or a vaccine, we need to respect social distancing, especially in indoors. And so we need to wear masks. And as we know, viruses are very dangerous if they enter the human body, but so it is very important to adopt measures of hygiene, particularly washing your hands. The cooperation with a few European countries has been extremely important, especially with Germany, and this has been important for the whole of Europe because the personal friendship that has developed between Minister Spahn and Minister Speranza, and my personal friendship with the president of the Robert Koch Institute helped Germany to move fast and avoid the consequences we had in Italy. Unfortunately, this did not happen with other countries, for instance, with Spain, even though we have a very good relationship with between the ministers of Spain and those of Italy, but we didn't have the same kind of reaction. We didn't have the same kind of response that was provided by by German politicians. And I conclude by saying that we have to open schools again, but, and I know that yesterday there were some events in Germany concerning the closure of some schools. We needed to try and limit the circulation of the virus outside schools, and also we need to have very strict standards within schools. In Denmark and in China, schools were reopened, but there were no negative consequences. So I do hope that we can carry on with the same strictness, with the same seriousness, and we have to take decisions only based on scientific data, not on emotions. Otherwise, the virus will win. Thank you. So that's a lot of food for thought. But I would like, first of all, to thank the the role that Italy had, that health staff, doctors and nurses had, and I'm really grateful. I had a lot of friends who really gave a very positive contribution, and I would like to add, and I know this is something that is also very important for you, I would like to thank all the associations of volunteers who supported the whole system. I remember one of our first debates when we talked about the connection between the social health, the national healthcare system and the social system, the social dimension. So this is a debate that we need to carry on. So, well, now I would like to leave the floor to Luisa Denkel from Germany, as I said before. I would like to thank her again for being with us today. There are a lot of questions we would like to ask her. Walter Ricciardi has already mentioned the first aspect. We are still in a phase of pandemic, so in Europe. So how can we define this moment? Are we at the beginning? Are we in the middle of the pandemic? So, well, I must say that I always try to give voice to the questions of others. I have children. I have a little girl of who's 5 years old, and she's happy to stay home. But if I have to think that my teenager children should stay home any longer, that would be a problem. So please, you have the floor.
Much for the kind invitation and also the kind introduction. I would like to start quickly with a short presentation on how Germany reacted to the COVID-19 pandemic. And as it was already mentioned, Italy played a very crucial role because Italy was hit first, and we have a very good cooperation with Italy and could learn a lot from them. So just let me quickly go to the first slide. Thank you. Here you can see the chronology of the COVID-19 cases in Germany. All of you will know that the cluster of pneumonia reported from Wuhan, China, was reported on New Year's Eve. And at that moment, nobody thought actually that this will be or that this will become a pandemic. Everyone thought that this may stay a local event and is not affecting other countries. However, it began to spread all over the world. And in late January, we had the first case in Germany with 14 secondary cases. And this first case was a transmission that took place during a business meeting. And the index case was a woman from China. And in the meantime, the virus was further spreading all over the world. So on the 30th of January, the WHO declared the public health emergency of international concern. So I need to see my slides again, please. Thank you. And shortly, can we go one slide back? Thank you. And shortly afterwards, the wave in Germany started in the end of February. And only 1 week later, we had the first COVID-19, only 11 days later, we had the first COVID-19 death in Germany. But we had, between the end of January and the end of February, while we saw what happened in Italy, we had some time to prepare. We could prepare our hospitals, we could prepare our laboratories to increase the testing capacity, we could prepare our public health system. So what did we do? Let's go to the next slide. So we have a public health intelligence group at the Robert Koch Institute in the Information Center for International Health Protection. And that group started to monitor the event in China. From the first day, it became public. And in the very beginning of January, the RKI already conducted a risk assessment. And in the mid of January, the RKI already activated crisis management structures. So And then when the wave started in Germany in the end of February, everything happened very quickly. So on the 10th of March, the mass gatherings were cancelled and nobody thought that it would be possible, but only 3 days later, schools and kindergartens were closed. And with the cases continuing to rise, on the 23rd of March, there was a general contact ban. And we had the peak of this first wave in the end of March, beginning of April, with 6,000 new cases per day. And so after that, we saw a drop down and we could relax our measures on the 20th of April already. And then you can see that we had a few weeks of very, some calm weeks, so to say, where we had only 500 approximately new cases per day, with a small peak mid-June that was due to local events and local clusters, due to a cluster at the workplace, for example, in a meat processing company. And now it's holiday season and people want back their normality and want to travel again. And so on the 9th of August, there was a mandatory testing for travelers returning from risk areas implemented. And let's come to the next slide to see what's up in Germany right now. And that's the same that happens in many European countries at the moment. Let's come to the next slide. Thank you. In total, we at the moment have approximately 230,000 cases and more than 9,000 deaths, with a fatality rate of 4.1%. But what you can see on the very right-hand side of this figure is that the cases are steadily and slowly, but they are increasing again. And so there is a worrisome trend. And just to end my short presentation with the next slide. With that slide, I wanted to answer the question whether we are still within the pandemic. I can clearly say yes. What you can see here is the world map, and you can see here indicated by the colors the so-called 7-day incidences. And here you can see some countries marked in red. And those countries marked in red have a 7-day incidence of more than 50 new cases per 100,000 inhabitants. And we as epidemiologists are alarmed by those figures, and because we think that this is a sign of community transmission, of a high level of community transmission. And here you can see that this is the case in 37 countries within the whole world at the moment. So let's sum up what I just mentioned on my summary slide, and I hope I could answer some questions already with that. Well, yes, we are right in the middle of the pandemic, and we have to adjust to a new normality. So we have to live with COVID-19. We have to adjust to social distancing. We have to adjust to wearing masks, and we have to live with uncertainties, especially when it comes to vaccinations. We do not know yet when there will be a safe vaccine. We do not know how the amount that will be provided, and we need to have a safe and an equitable system for that. But what we learned already is that we need a sustainable support for local public health authorities, and we need a working infrastructure when it comes to equipment, when it comes to digitalization, but also human resources. In Germany, for example, we hired 500 students from the healthcare sector and also other people with healthcare background to support the local public health authorities, because contact tracing is one of the key measures to fight the pandemic. And we need to better and improve and strengthen the communication across all levels, on the national level, but especially when it comes to vaccination, also on the international level. And the relationship between Italy and Germany show that how important it is to have an international dialogue, to share lessons learned and to share experiences. And this is also very important to strengthen the international organizations that are already existing. The WHO, ECDC, CEPI, Gavi, and also the European Union is involved. And as we are still in the middle of a pandemic, we need to invest in future pandemic, because within the pandemic is before the next pandemic, and preparedness is the most effective measure. Thank you.
Grazie, dottoressa Denkel.
Thank you very much, Dr. Denkel, for your overview. The last slide was most interesting, giving an outlook of the prospects of what we may expect. Some of those questions and some of those observations are extremely interesting. And now we'll give the floor to the other colleagues who are from countries that were marked in red and that are worrying a little bit, the United States and Brazil. Among the 130 squares connected with the meeting online, one of these is in Brazil. So now the floor goes to Professor Luiz Eugenio de Souza. Last year at the meeting, we had a European session about the global emergency for healthcare systems. And so we look forward to having his point of view and his observations concerning the issue we are dealing right now. You have the floor.
Thank you very much. Thank you for the introduction. Now, I'd like also to share some slides to make my presentation. So next slide, please. Yes, you have an overview of the pandemic situation in Brazil. We have more than 3 million confirmed cases since February, the beginning, and more than 100,000 deaths. And you can see in the graph in the side, in the blue line is Brazil, with the second highest number of cases on the planet, and also in the number of deaths. And we are in the 11th position among the 167 countries, with almost 500 deaths per million. And you can see in the line, the blue line, we continue to grow the number of cases. Next, please. Yes, you will have another big problem. That's the lack of national coordination of the response. We are now in the third Minister of Health, which the third one is an interim minister. That is a good person, but he has no expertise in health services, in health organizations. He's a military man. So the civil society decided to take the floor and make propositions in terms of a plan to organize and coordinate the response. This Front for Life, it's a huge movement organized by the National Health Council that has representatives of different segments of different parts of society, the Brazilian Academy of Science, the Brazilian Society for the Progress of Science, the National Confederation of the Bishops of Brazil, and several health professionals organizations, including the Brazilian Association of Quality Health for Brazil. So this movement has been proposing a plan for national coordination of the response to the pandemic. Next, please. This national plan makes several recommendations for public authorities, political leaders, and also health managers, but to the society at large. The main strategy recommended is the concerted action of primary health care and epidemiological surveillance, with an active search for confirmed or suspected cases and blocking of transmission. Several state governments and local governments from the municipalities are taking this kind of action supported by this plan. And also measures for qualifying the specialized and hospital care we had an important expansion in the number of beds, including the ICU beds for care of the people in the moderate and the severe cases. And more than that, we are proposing also strategies to mitigate economic damage, supporting financially the small companies and vulnerable populations. We should say that the Parliament was more sensitive to these kind of actions and has approved a kind of support, financial support for all the poor population, even with no support from the executive branch of the government. Next, please. The whole chapter of this plan is related to the strengthening of our unified health system, the public health system that it's spreading all over the country in each municipality. But we need to implement regionalized healthcare networks, because now we have just municipalities in a fragmented way working alone. We need to develop and to strengthen the health promotion and surveillance systems, to increase investments in our unified health system. We had an emergency budget for the pandemic, but now we have no provision of continuing financing to this system for the next year, for example. We need to improve the unified health system management, to encourage and support social participation. You must know that the National Health Council is composed by people from the users of the health system. The social participation is very important for the functioning of the system. And we have to improve health workforce management. Unfortunately, we are the country where there is the largest number of deaths of health professionals by the COVID, caused by the pandemic. And finally, we should intensify cooperation between the federal government, the states, and the municipalities. Next, please. But actually, we need to renew society. We know that pandemic is part of the production method adopted by our societies over the world, and that will generate new critical events which may overlap, combining pandemics, disasters, and planetary crises. It's not desirable to return to the normal situation prior to the pandemic. So, processes must be triggered for the reconstruction of living conditions based on the values of freedom, equality, and solidarity. Next, please. The pandemic caused by the new coronavirus was not at all a surprise. The high-level panel on global response on health crisis, created in 2015 by Dr. Ban Ki-moon, UN Secretary General, after the Ebola epidemic, already predicted the occurrence of pandemic in the years to come. Despite warnings, societies were not prepared to deal with the pandemic. In May this year, more than 200 entities and global personalities launched the Sustainable Health Equity Movement, led by the World Federation of Public Health Associations. This movement has sent a letter and has meeting with the UN Secretary General and also with the WHO staff and Director General, Dr. Tedros, proposing to create a global health equity task force. Next, please. We need a stronger multilateralism. This task force, which should be housed within WHO, would be charged with taking the necessary steps to exert needed global leadership for a comprehensive, equity-focused response to the pandemic, guided by the ethical principles of the Universal Declaration of Human Rights. We actually must follow Pope Francis' advice. The answer to the pandemic is twofold. We must find a cure for a small virus which brings the whole world to its knees. And we must cure a great virus, that of social injustice. Thank you very much.
Grazie, grazie moltissimo.
Thank you for your intervention. Well, this was more or less what I was saying earlier, that is to say, a reawakening of the social dimension. It was never really asleep, but this is an aspect that is extremely important, a response that can in a way support the actions from the bottom, and that is to say the actions of associations and people. And I would like to add that we are acting mainly locally, yes, but we are thinking globally. So let's move to the United States and let's try to understand the impact also in the future months of the situation. We talked about big data, digital transformation, artificial intelligence, but I would like to add something. It is fundamental to have all this, but we needed to have also an attention for the people who actually then use this kind of information. So otherwise there will be no real solutions. And that's what Professor Paul Barak often says. So, well, I watched or on YouTube some of his lectures. Thanks to these digital tools, we can actually virtually meet our guests, and so I've listened to his lectures on the learning organization. So that's what I would like to ask you about. Thank you for being here, first of all, and you have the floor.
Hello, everybody. Welcome from the United States. Indeed, this virus is, more than anything else, is about a new normal that's challenging how health and society will look in the future. I think the cardinal issues, there are several that have been alluded to, and I want to focus on others that have not been mentioned yet. The first question for our societies is, how quickly and how humbly are we able to learn from the events? I think the examples of the cross-country learning between Germany and Italy, for example, the remarkable leadership in Modena and Emilia-Romagna, there are examples around the world where local authorities partnered across jurisdictions to share lessons about resources, about how quickly to mobilize, about where to help, where to pause, where to listen. Those are very important lessons, and I think it speaks to this incredible property of systems learning. How well are our systems able to harvest the lessons from one county and from one country? Clearly, what the pandemic has exposed is that we've not invested enough in systems and human factors. And so a variety of elements that I'm going to allude to speak to the fact that we must move forward by thinking differently about how do we prepare our systems. While it's important to have preparedness plans, what we've discovered from disaster medicine, from lessons from quality and safety, is that so much of the actual work is emerging work. That is to say, what happens on the front line might be different than the way we predict. And so the tempo of learning is predicated on how well we're able to harvest those lessons. Number two is the role and importance of protecting our healthcare workers. I was very moved by a very visual campaign in Germany in which dozens of healthcare providers were in a campaign in which they were mostly naked, talking about how they felt as doctors and nurses, naked without proper personal protective equipment. As of last week, Amnesty International has recorded that over 3,000 healthcare providers, doctors and nurses and other primary workers have died from COVID, and over 500,000 have been infected. These are remarkable numbers. It's clear that we've not spent enough energy, time, and money in protecting our healthcare workers. We've assumed that occupational health is a bygone issue, but in fact, the risk to healthcare providers, including in the last several weeks to months, remains remarkably high. This has had consequences that are not just short lasting, but they're going to go on to the future. And that is, do we have proper equipment? 1/3 of healthcare providers in many places around the world, in South America, for example, in Mexico, or in Europe in certain places, or in the US, still identify 1/3 of them say that they do not have enough personal protective equipment, even 6 months into this pandemic. This is a remarkable organizational challenge. When healthcare providers don't feel protected, when they feel that their safety is being neglected, when the language that's used to pacify politicians, but not to protect the providers, that leads to a serious breach in trust and what we call a lack of psychological safety, where the nurses and doctors are unable to speak up. We've known for decades around hospital management related to quality that when nurses, for example, do not feel safe to speak up, more patients die. When physicians cannot speak up about issues on the front line around equipment, around proper medications, around proper staffing, more patients die. We know that. We know, for example, that on nights and weekends, when you have less senior doctors and nurses, more patients die. And so we've learned over time that listening to the frontline workers, the pharmacists, the nurses, the doctors, listening to what they say and adhering to those signals is very, very important. So the speed of learning, the protecting the workforce, these are key innovations that COVID has taught us to pay more attention to. The third thing I want to focus on is the learning. There's been a remarkable increase in virtual care or telemedicine. For example, in the US, there's been an increase of over 4,000%. 4,000% in increase in the use of telehealth. This is a remarkable transformation that will never quite look the same afterwards. Many patients want to be cared for in their home or in their workplace or on the road. Many providers have learned that it's safe to do so, that it gives them the ability to see patients wherever they are. Not all patients, and clearly not for the very sick patients, but for the majority of patients that aren't very sick, telemedicine, virtual care offers remarkable opportunities to provide care that's equal and equitable in remote places, allows it to do it 24/7 around the clock, and allows it to do it in a way that's safe and protects the privacy of the patient. So I think that's a remarkable thing that we've seen, that virtual care on scale is possible and can save a lot of money and resources that are otherwise unavailable. And another key point that we've been focusing on is the quality of leadership. I'm convinced, and I think more and more work is coming out, that one of the reasons why countries like Italy have done so well under Walter's leadership and others is the ability to learn quickly and to take those lessons and apply them. There are other countries, unfortunately, like my own, which have not been wise enough to listen to their public health leaders. And subsequently, we've been repeating the same problems again and again. And so the ability to have what we call resilient leadership, and I want to break that down, what I mean by that, these properties of resilient leadership, number one, is being very transparent about the data. So lessons that emerge from Italy, from Germany, from Israel, these are countries that very quickly gave the public real data about how many people were sick, about where there are hot zones in the country. And by doing so, we're able to start building trust. That's a key element. That transparency in data, the consistency and humble way of sharing data meant that people were more willing to share and to absorb the more difficult choices. For example, in South Korea and Taiwan, one of the earliest things they did was creating apps that would allow people to know where to find flour, where to find toilet paper, where to find wipes. This might sound not that important, but in fact, in Taiwan, when you ask people, do you trust the government, they have one of the highest rates in the world. When they're asked why, they said, because when I needed to find out where I could buy staples for my family, flour, rice, and toilet paper, I could find it immediately. Whereas in many Western countries, in Australia, in Europe, in the US, for months, you couldn't find toilet paper in the supermarket, even though there was more than enough toilet paper in the system. But because of supply chain mismanagement and because of lack of understanding of the data, trust was breached. The second thing is embracing learning opportunities. So these resilient leaders embrace the opportunities to learn, and that learning leads to more trust. The third thing, of course, is being humble and honest about what we don't know and when do we have to ask for help. And I think that conveyance of empathy and compassion with calm and reassuring messaging meant that people were willing to follow, they're willing to sacrifice their freedoms, and they were willing to do the hard work, which is about the public producing safety. We call this co-production. So we, together with the public, which is really at the heart of public health, were able to work together. So just to sort of summarize those points, number one is this issue of learning. Do we have systems that are able to learn? Number two, are we willing to have the leaders that are going to be humble, using transparent ways of sharing data, owning the narrative, not trying to blame others, leading with empathy and compassion? Number three is the issue of virtual care, using this opportunity as a way to innovate, to provide care across jurisdictions. It could be across regional areas, it could be across countries. And finally, the issue which I think has emerged the most foremost really is this issue of protecting our workforce. We've learned from SARS, MERS, and Ebola the workforce can be incredibly vulnerable. But as opposed to those three previous epidemics, within 6 months, we've had an incredible physical, spiritual, and mental challenge to healthcare providers with dramatic increase in depression, dramatic increase in unhappiness, huge amounts of burnout, and what's clearly being apparent is increased rates of suicide and suicide ideation. We need to be prepared for this wave of mental unwellness, because these healthcare workers were unprepared for this. They didn't have proper equipment, certainly in the first few weeks and months. For example, in Italy, with hundreds of healthcare providers that have documented to have died. In the US, where the CDC recently has documented there are 900 healthcare providers that have died. These are staggering numbers, and they're frontline workers. They're surgeons and anesthesiologists. They're emergency medicine nurses and doctors. They're porters. They're laboratory workers, and they're hospital managers. So this is really a new challenge to us. How do we provide the services that we've all been talking about, but are still able to protect our healthcare workers so they feel safe to come to work? They feel safe that they will not contaminate their loved ones when they come home, and they're able to look in the eyes of their colleagues and say, I feel safe to come back to work. So this balance between protecting the patient, protecting the system, and protecting the healthcare providers is something that we must learn more, do more research on, and share these lessons as we prepare for these next waves of the pandemic. So I think in many ways, this is a new abnormal, not a new normal. And we have multiple choices that we face as public health leaders. And that's our challenge. Are we going to lean into these opportunities, or are we going to shirk away from them? Are we going to invest in public health in a way that we've not been doing for the last several decades? And are we going to celebrate leadership that's resilient and compassionate, that tells the truth to the public? Thank you so much for your time, and I look forward to the questions.
Grazie a lei.
Thank you so much for your comprehensive comments. I've noted down vision, will, and speed in the response, but let's hear from Professor Vittadini. Well, I'd like to sum up what has been said in final speech that Walter Ricciardi said. I think that what has emerged is the why this pandemic has made the healthcare system take a methodological leap forward. The healthcare system cannot do without clinical standards, hygiene, and technology. Normally, we consider healthcare systems with respect to big surgery operations, but here we know we need a vaccine, and we know that hygiene has been the fundamental factor in the development of healthcare in dealing with many pandemics. So this new idea of healthcare is interesting. And then the workforce has been mentioned. continuous training. These are not just mere professionals working in a hospital, but they have to be very well prepared. All our guest speakers mentioned the fact that there was the need to transform the workforce and to have more specialized people. And third is the issue of subsidiarity. There are issues due to the shortage of face masks or protective devices. And then fourth, there is the state, the role played by the state. There must be an organization that is directing everything. Otherwise, there's no way out of this. So maybe, Walter, if you could comment on a few aspects in terms of the change that we see. Well, I believe that really important remarks have been made, and collaboration has always been there behind the scenes, but this must be fostered more and more to guide government's decisions at national and international level. Very important things have been mentioned from the clinical, care, cultural, workforce system point of view. We have seen an extraordinary example, which even in the UK could be seen. That is the civil society getting together to try to give immediate responses. I'm not now criticizing the government of a foreign country that is not responding in an efficient way, but we have seen the civil society reacting in Brazil and in other countries. In Great Britain, even science got together outside the government because they saw all the problems. And then there is the Italian Scientific Committee that is very much listened to, but in the UK, an independent one had to be set up because the government was not following scientific evidence. So this is a great challenge. And my final remark refers to what Paul and Louise said. That is the challenge of leadership in all these sectors, the clinical sector, the public healthcare sector, in the political world, in business, and in society. We need people that can finally be aware of what should be done. We are at a historical point, and the previous models used that exploited all the resources, putting human beings so close to animals, and there's now easy transmission of diseases from animals to human beings. Well, we know it's there. We know viruses can be conveyed and transmitted throughout the world. Consider that in the past, pandemics were so few that can be summarized in a few pages in history books. But in the 21st century, we've had so many already. And this probably is the most disrupting one. It is not actually the most serious ones because coronavirus is not as lethal as other viruses. But what happens if at the same time we should have an even more aggressive virus? What about the impact on the economy, the impact on the healthcare and our development? So I'm pleased to mention what the World Federation of Healthcare Associations have done. This association has played an important role. I have interacted a lot with the Chinese Medical Prevention Association, which groups thousands of physicians from China that share their data and their information at the beginning of the pandemic. Now I have the honor to be the president, and Eugenio is the vice president, and we have the firm intention to launch a campaign to establish this leadership throughout the world. So there is this public leadership coalition that will start in October with the World Congress that should have been organized in Rome, but it will be held online. It will launch a recruitment campaign because we need goodwill people to join and to participate actively in those places where there's governments that maybe are resistant and maybe not following the public interest, and so they can be put under pressure and convinced to do better. But the challenge, as I said before, is to make decisions on the basis of evidence and not just on feelings. Thomas Friedman, the director of the ECDC, the other day published data on the economic loss. SARS, 5 billion pandemic influenced more or less 5 billion. Only the United States, this pandemic cost $3 trillion. So there can't be economic development without health safety, health security. There can't be economic development if we don't change model. And I want to mention what Pope Francis said. It's a great opportunity. Let's not miss it, because if we miss it now, we'll be paying for all the consequences in the future as soon as we have new cases, possibly more serious cases. We need to prevent all these situations.
I nostri ospiti, ringrazio.
I would really like to thank all our guests, those who are here in Rimini and those who are not here, that are, well, let's say, from every corner of the world. Thank you for being with us this afternoon. When I was preparing this session, I was considering the importance of the word emergency. It has a meaning that is positive in Latin, something that is singled out. So this emergency showed us that things cannot be done in isolation. We have to work together. And as a friend of mine told me this morning, when he was wishing me luck with this afternoon session, the victory is not the result, but rather to be ready to accept the signs that come from the reality around us. Thank you.